Hi, everybody. This is Betsy Wurzel, host of Chatting with Betsy at Passionate World Talk Radio. Jeanne White is the producer and writes the blog, which I highly suggest you read because it's going to have a lot of information. And please subscribe for free my show, Chatting with Betsy, on Spreaker, Spotify, Google, iHeart, because I have interesting guests with great information, and you don't want to miss it. I am so honored and privileged to have my special guest on today, who is also a host on Passionate World Talk Radio with her show Wine and Cheese about nurses, which I highly suggest you subscribe to and listen to because it's a fantastic show. I am doing a series on advocates and being an advocate, and Sheila Wilson is a role model on being an advocate when you see something you don't like and you do something about it. I want to welcome Sheila Wilson, R.N., CEO of Stop Healthcare Violence. And I just love what you do, Sheila. Thank you for coming on Chatting with Betsy.
Thank you, Betsy. It is an honor for me to be on your show. And trying to do Alzheimer's is not an easy task. There's so much information that you have shared.
Oh, thank you. Thank you. Sheila, I want people to know your background, how long you worked as an RN, how you got involved in your advocacy. And it was through Jeanne White that I met you and found out about what you're doing because I never thought of healthcare violence when I worked in a hospital 36 years ago. Never crossed my mind. I mean, because it was a different world back then. So please tell us about your background. I know you wrote a book and you write, articles. So go ahead, speak your truth.
Okay. I always wanted to become a nurse, even when I was a young child. And when I was in high school, a lot of my friends were going to go to nursing school, and I took the test and I did everything. And my counselor at school said, I don't think you're ready for this, and why don't you go do something else? I was heartbroken. So I did. I went and I became a bookkeeper, very far from what that happened. And then I got married and had 4 children, and I was sitting at a baseball game with one of my kids. It was just the little kids league. And I heard in the background my neighbor talking to somebody. And I knew my neighbor. She had 7 children. But what interested me was that she was saying how she was in nursing school. And all of a sudden, that whole desire, that passion to become a nurse started again. So that was back in 1976. I talked to my neighbor, and by 79, I graduated from nursing school. And I was so happy. I was so proud of myself. I could picture my parents up there. And it was just amazing. And I met a very good friend, and still a good friend to this day. And this is 40 years later after I've been a nurse. Before I was a nurse, I was a medical assistant. And I happened to be in a room talking to a patient that had 3 limbs tied because he was violent. But I was asked to go in and make sure he was taking his drink that he needed to drink for the nurse. And while I'm talking to him, and we were talking about his brother, somebody very casual. I knew him. I went to school with him. And this guy, he had one free arm, and he belted me so hard in the face. And I can't remember, Betsy, what the gloves were made of at that time. I know there was powder in them, but I filled up a glove with ice to put it on my face, and my face was so hot it burst the glove.
Oh, my goodness.
It was like, and
that's terrible.
It is terrible because
I
thought
awful.
For sure I would have a black eye. Security came up and took a report from me, and that was the end of that. I never heard another word. Nobody in administration said anything to me. And I'm talking 40 years ago. But that was just about it. I didn't see a lot of violence. And the years went on. Now let's fast forward it to 2008. I'm working in the emergency room. I have had one of the best careers any nurse could have. I've been in several places. I always worked at one hospital that I loved for the 40 years, but I also did part-time elsewhere, and that's where I was able to learn a lot more. With my bachelor's program, I learned community health, which I didn't like. I didn't like the way some of the elderly were treated and what was left for them and all the work that they had to do to get anywhere. But again, we're talking years ago. Then I went for my master's, and I got my master's through a program called Community-Oriented Primary Care when we went out again into the communities, and I learned a whole different version. But it was 2008 that two other nurses and myself knew that the violence in the emergency room, which we all worked, was getting worse. All of us were getting hit, slapped, punched, yelled at, lots of derogatory words. I mean, you walk out of there, your head just is full of things. They're threatening us. They'd come at us. One girl was pushed down to the ground, and the fella got off his stretcher, walked over, still had his boots on, and kicked her in the face.
Oh, my goodness.
Another one came walking down from a triage area and saw the security guard on the floor being beaten by a patient. She called for help. They got him up to the stretcher. They tied him down with 3 limbs, but the one leg out, she kept getting hit because every time she tried to grab the leg, he would kick her in the shoulder. And she's never worked since, really. She couldn't. She went home, and her grandson, who she was caregiver of, cried the minute he saw the bruises on her shoulder. And she couldn't tell him that a patient hit her. Another one was strangled with her stethoscope. So all of these things were happening, and we knew we had to do something. But just to say something else is we didn't have a security guard there, but we could call him. There'd be absolutely no problem calling a security guard down, but there was 3 to cover the hospital and the medical building behind us. So that would take a few minutes. So by the time they would come, we would be really hurt. So when somebody started to get agitated and to reach out and grab us, you'd yell for help. Other staff members would come. Sometimes the doctor would come. And by the time security came, as I said, we would be hurt. Now, 3 of us, we were all at a meeting, and it was a workplace violence committee meeting, which was new, and we fought to have a security guard there 24/7. It took a while for administration to get that in place, but finally, after months, we got a security guard there 24/7. And he helped immensely, and it would be different security guards. But they weren't trained. They didn't have a whole lot of training. A lot of the security guards were neighborhood kids, and they could calm the people down just by knowing them. And other ones were just, maybe they just got out of the service and they had a lot of testosterone. A couple of times we'd have a female, and that was great because she could handle the females. The females were just sometimes out of control. But the people that hit us, they were mean and they were angry. We wanted to, we did reports. Nothing came of these reports. You write a report, nobody called to see how you were. Even your clinical manager didn't call and say, "Hey, how you doing?" Your coworkers might, but it was like, okay, am I going to go to work today and come home with a black eye? Maybe I'm going to lose a couple of teeth. We never knew. And it wasn't people like an Alzheimer patient. We're trained how to work with an Alzheimer's patient. It wasn't somebody that had come in with a seizure and was flailing around. And it wasn't somebody with a low blood sugar. It wasn't somebody with a diagnosis that you should, as a nurse or any healthcare worker, no, you don't walk in and start doing things to a patient without explaining and listening to the patient, and if the family member came with them. And you take that and you work with that. It may take you a little bit longer to get your tasks done, but you won't get hurt by frightening somebody, or like a 2-year-old child. You don't go running up to them and grabbing blood and holding them down and putting machines on them without explaining something. These are people that are mean, nasty. Sometimes they've had too much to drink. Sometimes they have.
I was going to ask you that. Were they alcoholic or drug addicts?
Well, we've had a lot of alcoholic and drug addicts, and just let me segue here for a minute. I started an alcohol recovery program because I know what an alcoholic was. I worked in a lot of detoxes, and I got volunteers to come in, and they would talk to the people that had been drinking and they fell off a stool or whatever made them come to the ER. And they could get a bed in a detox if they chose to. I mean, there was something there. The people that had overdosed and were giving them Narcan, that was tough because we ruined their high, and they'd come at us like crazy. But we knew that would happen, so we stayed away. It's the folks that you just don't know, the ones that look nice and sweet, and they come at you with a fist or a knee or a foot. It was terrible. Sometimes it'd bite us. We'd put our hand across, which we shouldn't have done. You know, we'd go to grab the one arm. We're on the opposite side. And they'd just clamp their teeth down. So we started making, would have medical incident reports. You make out the incident reports, but if nobody says anything, then why bother? Nobody cares. And then it ended up being computers, and your incident report would go to a computer. You wouldn't even have a copy. So you couldn't go to court. And you could go to court. No. Now, some hospitals, they really don't want their nurses to go to court to charge the person that assaulted you. In our hospital, that would be okay. They didn't help, but, you'd have to swap time with everybody, and you bring them to court. But even that didn't work very well. This one nurse was in a room, very, very busy night, and she took care of this patient that she had known because she came from the intensive care unit. Now she's working in the ER, and she's talking to the fella, but the fella is agitated, wants to call the wife. EMS had just told her there was a big argument with the wife, and so all she wanted to do was take his blood pressure and put on the EKG leads because they said he had chest pain. And he wouldn't do it, so he hit her so hard in her face that she fell into the cabinets behind her. She yelled out, "I'm hit." EMS got him. The gentleman's now standing in the room, banging on his chest and his head, saying, "Come on, come and get me." And that nurse didn't come back for 6 months because she couldn't move. She had so much trauma to her face, her back, her shoulders, her whole bit. So she brings him to court, and she went through the whole process, which isn't easy, but it gets done. And the judge said, "Well, we don't think that he had your name on his head when he went into that ER. So instead of, as I know that you and your husband would like him to be put in jail for the trauma he caused you, I'm going to give him probation." He
Oh,
never
my
followed
goodness.
through with one thing because of cost.
That's awful. And then they want to know why there's a shortage of nurses. And
right. I mean,
that's awful.
Really,
And Sheila, the baby boomer nurses are retiring. They're going to be retiring left and right. And it's going to be very short staffed.
Yes, it is.
Because no one's going to put up with this.
No, and they shouldn't. Now, but why is this still happening? Now, I've been doing this since 2008. And we've really, I've published many articles. As you said, I've written a book, and we talk about it. We're on cable. We've done lots of shows, Wine and Cheese. Now, Wine and Cheese is a lot about the pandemic. It started with the violence. But why doesn't the hospital pay attention? Now, we have
That's a
when
good
I was
question.
working, I was a union member because you had to be a union member if you worked there. And they gave you 5 days if you got assaulted. So you say, I'm assaulted, you get a doctor's note, and you work full-time with anybody that's there. They're going to give you a doctor's note and quickly look at you. And still, nobody calls. Nobody says, hey, how you doing? And so why do we stay?
Because you love the patients and you love your work. But the morale must be lower than low. And not just that, it's the time off that these nurses take. And if somebody bites you, don't you need a tetanus vaccine or get tested for HIV?
Yes, and it used to be a terrible thing when we first had to tell people we're doing HIV, because that was still relatively new. And it was like, oh, my God. And one nurse did get it from an assault, but I didn't hear of any others in my hospital. It's terrible. You get bitten, plus you need the antibiotics. You need to go for sometimes IV antibiotics. So, the mouth is a terrible thing. It has so much bacteria in it, and it can cause so much trouble. But it's everything. Now, not in my hospital, but there was one nurse that was kicked by her patient. She died 3 days later from a blood clot.
Oh, my goodness. This is just awful. And I think, Sheila, this is only my opinion, but I think society and the way, and people may not like this, but I say it like it is, parents are not raising their children properly. Not all parents, but you know what? I work at a preschool, and I see what these kids do to their parents, and I'm shocked. Mm-hmm. They have no respect, and I'm talking from 3 to 5 years old. They are kicking their parents, screaming at them, hitting them, and the parents don't say a word. Not a word. Wow. And so they have no respect. And, they'll say, oh, Miss Betsy, they don't listen to me. I even had a parent say, can you tell my son not to hit me out in public? Are you serious? So I think it stems like a lack of respect. It's not taught in the homes anymore. And, it just carries on. Anger management issues seriously need to be addressed. I'd like for you to tell the listeners how you got to start your campaign and go into the where Massachusetts, your state government.
You mean to try to change the bill?
Yes.
I was never politically inclined. I didn't know what to say to these guys. Never knew any of them. And one of the fellas, this Bruce is, he was a representative over in Quincy where I live. And so, I just knew him and knew of him more than knew him. And being in the union, 2010, I went because Governor Deval Patrick was going to sign a bill into law. And I ended up being on the picture of the cover, which I really didn't belong there, but the girl that should have been there asked me to take her place. So he basically signed it into law as a misdemeanor. And I thought, in my own head, I thought it was supposed to be a felony law to assault a healthcare worker. Now, there'd be some stipulations on that law. You know, they're not going to put him in jail for a slap. But if you're really hurt, he ought to be punished. So I thought, all right, maybe I misunderstood, but I really don't think I ever misunderstood. So it was like 2 years later, I had called Bruce Ayers, and I had asked him to do a bill. It was either that 2 years or 2 years after that. And he said, sure. So we decided we would try to put the bill into for a felony law and for assaulting healthcare workers. M&A, the Mass Nurses Association, also is very active in doing a bill. So we didn't have the two bills at the time, but the bill was out there. And it goes into all of this foolishness that they have to look at, and then it either goes into study or it goes to like Ways and Means or some other program to get okayed or denied. This bill has never passed, although 36 other states have it. So last year, I did it this would be the last time because now I'm a nonprofit and I can't go lobbying with the politicians. I thought for sure it would pass because more and more nurses were getting assaulted, and it's everywhere. It's not just the U.S., Betsy. It's everywhere. And but I went up to the State House several times, talked to a lot of people, and they said, well, you know, we don't know if it's really going to pass. And I said, well, why? Give me an idea. Why? Well, we don't really have enough money to keep, you know, the prisoners, the jails are full. Well, okay. So it's okay if somebody ruins my life, but you don't want to put them in jail. Well, then they said, you know, really, is it that necessary to put them in jail? Well, what's the alternative? Oh, we discussed, like, the domestic violence. You know, if the husband or the female assaults their partner, they can go to, like, a 10-week program. And if they pass that and they really do it, well, then they don't have to, you know, they get a go free, and they don't go to jail. Well, could we do that for somebody that assaults us? It's not just one person one time. That does happen, but there are people that the nurses are taking care of that assault them every single time, no matter what you do or how you treat them. So, you know, that's the type of person that really needs to get punished.
Yes.
So,
yes.
It just happened that they decided they don't want to do this. And you say, well, why? I mean, some of these people had nurses as daughters. The story I told you about the nurse that the judge told her that he wasn't going to put that person in jail had a daughter of a nurse. And so you kind of say, boy, I hope the daughter gets hurt, but you really don't want that to happen to her.
Right.
But now what would happen if his daughter got hurt? Would he change his mind on that?
I'm sure he would. I was going to say, you know what, it's going to take somebody, unfortunately, who's high in the, you know, upper crust society, or maybe a judge's daughter, maybe a lawyer's daughter, somebody political and they get hurt doing their job as a nurse or doctor or whatever they're doing in the hospital or facility, and then something will change. And maybe that's what it would take, and it's sad to say that, but if you look at people who've been arrested for murder, if they killed anybody that was high political, they don't see the light of day again. If they killed you or I, they'd be out in 18 months.
If they get in there at all.
Yes, if they get in there at all. Is there police officers in these emergency rooms?
Well, every emergency room is different. I can tell you a quick little story about, we had, at one point in time, we had security, and the head of security was a local kid, and he was a man at this point, and he was very professional, very kind, but he grew up, he came from a large family. He knew how to fight, and he knew how to fight with his fists. So he was kind of like, in our own minds and our hearts, we knew if he came around, we would be safe because he knew how to handle himself. Okay, you got a picture of what I mean?
Right. Yes. Mhm.
So, anyhow, there's a gentleman that was on. The police were there, and they were guarding this guy. But something happened with the police were gone. They're not there. They weren't at the hospital permanently. They were only there with this patient. Well, something happened, and the director of security came down, and the patient knocked the director of security out flat. It had to be a surprise attack, so we were all kind of looking, oh, my God, what are we going to do? Well, we got it all settled down. The police ended up coming back. That was taken care of. However, the patient was still there, so the director of nurses called in the Boston police and had them guard this patient, so he was always guarded. And so one of our nurses, who used to be a shop steward at Boston Medical Center, she's a tough cookie. She went to our director of nursing and said, oh, this is what you do. So one of the top people get hurt, you call in the Boston police. But if one of us is knocked on the floor and out cold, who do you call? Nobody. And it was a big argument. But that's what it is with the higher-ups.
Yes.
You just wonder to yourself.
True. Yeah.
And it was a big problem. We lost an awful lot of respect for this director at that time because we knew. But I would imagine right at the first gut reaction was to get the police here, because not so much that he was the director of security, but the fact that a person was out cold. So you never know what somebody is thinking. So right or wrong, we held a grudge against her for a little while. But
well, I could understand why. I could definitely understand why.
It's just hard.
It is hard, and they're going to lose nurses, and people won't go into the profession. And I can't believe how fast time goes, Sheila. I love talking to you. And folks, Sheila Wilson, R.N., great advocate. Sheila, can you tell people, it's going to be in the blog, but can you just tell people a little bit where they can get a hold of the Stop Healthcare Violence, where they can learn about it?
Okay, we're on Facebook, and it's Stop Healthcare Violence, Facebook. I have my website, which is stophealthcareviolence.org. You can email me at Sheila, which is spelled SHEILAW6, at Comcast.net. I'm also on The Wine and Cheese, and that's on Spotify, iHeart, Passionate World Talk Radio. It's also all over my Facebook. Did I miss anything else here, Betsy?
Your book. What is the name of your book?
My book. Oh, thank you. My book is The Shocking Reality of Violence in Healthcare and What We Can Do About It.
And how does someone purchase that?
You can go right on Amazon, and it's right there. Or you can call me, and I will mail you out one.
Oh, that's excellent. Folks, I'm telling you, get Sheila's book, listen to the Wine and Cheese. I listened to it, I posted, and I told Sheila earlier, I tried to post it in 2 groups on Facebook, nurses groups, that are complaining about these same things, and they wouldn't post it on there. So I think nurses need to, band together. I know back in the Stone Age, there was not a union in the hospitals where I worked. You were fired if you talked about a union back then. Things have changed, and I think, Sheila, we need the younger generation needs to teach their children to have respect and to manage their, anger. I really do, because I'm appalled about what I see and what I witness. And I could understand why these people just go off, because they were never brought up with any boundaries or taught any respect. So I want everyone to know that Sheila's show is where she said it was. Please watch it. Please listen to it. Share it. And get it out to these nurses. Get it out to the public of what nurses are going through. And I want to say God bless all you nurses out there, every healthcare worker. Thank you, Sheila, for coming on. And
thank you, Betsy.
Thank you, to the girls that come on your show and speak their truth. This is what Chatting with Betsy is about. People speaking their truth, giving out information that's important that you may not hear anywhere else, but you will hear it on Chatting with Betsy, because no topic is taboo with me. So I am Betsy Wurzel, host of Chatting with Betsy at Passion World Talk Radio. You can follow me on my Facebook page, Betsy Wurzel, WURZEL. I also have a group, hashtag Kick Alzheimer's Ass Movement, if you're interested in being inspired and educated about all things dementia. And even if you have dementia, you can come join. And I would like for you to join. And please, people, respect the healthcare professionals. They're there to help you. They don't see their families. They're isolated from their families. They're working in unhealthy conditions. And if you want to know, right? And if you want to know more, listen to Sheila's show, Wine and Cheese. I'm telling you, it's a great show. I love it. I listen to it. And I post it on my own page and on my Kick Alzheimer's Ass page, because I think people need to know the reality of what nurses and other healthcare professionals are facing. So be kind, people. When you go in a hospital, be kind to your nurse. Really, you need and anybody working. They're there to help you. Okay, they're there to help you. Don't hurt them. So until we chat again, be safe and be kind. You can listen to this again on Spotify, Spreaker, iHeart, Google, Amazon, Alexa. Subscribe for free, and you won't miss my shows. And it is all for free. So thank you, everybody. Until we chat again, be blessed. Bye-bye now.